Welcome to the Healthy, Wealthy, and Smart podcast. Each week, we interview the best and brightest in physical therapy, wellness, and entrepreneurship. We give you cutting-edge information you need to live your best life, healthy, wealthy, and smart. The information in this podcast is for entertainment purposes only and should not be used as personalized medical advice. And now, here's your host, Dr. Karen Litzy.
Hey everybody, welcome back to the podcast. So happy to have you join me for today's episode featuring the American Physical Therapy Association's president, Dr. Sharon Dunn. So for those of you who are not familiar with Sharon, she received her BS in physical therapy in 1987 from LSU Health Sciences Center in her hometown of Shreveport, Louisiana. She has since completed a Master's of Health and a PhD in cellular biology and anatomy. She has been a faculty member at LSU since 1990, currently as an associate professor and chair of the Rehab Sciences Division. Since beginning service through the professional organization as a student, Sharon has served as the State Government Affairs Chair, Louisiana Chapter President, Vice President, and Delegate, and of course, as I said, she is the President of the American Physical Therapy Association. And I was lucky enough to catch up with Sharon just last week at the Federal Advocacy Forum. If you're unfamiliar with the Federal Advocacy Forum, go onto the APTA's website, check it out. It's a great couple of days in Washington, D.C. It's the first time I've attended, and I will definitely be going back for years to come. It's great to see how the legislative process works, how the APTA is advocating for the profession. And again, it was great to sit down with Sharon and talk about some of the things we're advocating for. We also talk about some big policy agenda wins for the APTA, new public priorities for 2018 and beyond, and how to bring advocacy to your community, your state, and your county. So this is a great episode. And like I said, definitely check out the Federal Advocacy Forum. You really get to understand how the APTA works with the federal government to make things happen. So I know a lot of people say, well, what does the APTA really do? Go to a Federal Advocacy Forum. See the hundreds of physical therapists there from across the country who are there to advocate for their state, who are there to speak to their legislators within their state or to the legislative aides who are pounding the pavement to get things done. So it was a great couple of days in Washington, D.C., and I really thank Sharon for all of her support, for her willingness to sit down and talk with me for a little bit about what's going on the federal agenda and on the advocacy front for the APTA, and I hope you all enjoy. Hey everybody, I'm coming to you live from the Federal Advocacy Forum through the American Physical Therapy Association in Washington, D.C., and I have the pleasure of sitting next to the president of the APTA, Dr. Sharon Dunn. So Sharon, welcome back to the podcast. Always an honor and a pleasure to have you on.
Thank you, Karen. It's an honor and pleasure to be here, especially at the Federal Advocacy Forum.
Yeah, my first one.
It's wonderful energy, do you think?
Yeah. I'm looking forward to really learning more about how to properly advocate and how to speak to lawmakers, because I think there's an art to it. It's not just go in and throw a bunch of data points at them.
Yeah, it's a conversation, but an ongoing conversation that is more of a relationship than it is a one-time deal.
Yeah, so it's not a one and done.
Yeah, no.
And why is advocacy so important for the physical therapy profession? And maybe put that in the context of as individual physical therapists versus hiring lobbyists to do our work for us.
Yeah, well, number one, your legislators who represent you on the Hill want to know what's important to their constituents. They know they're going to have lobbyists come to them from organizations, but what is really meaningful to them is when you can share a story about your patients that affects people in their community, because they want to represent well. And the reason it's incumbent on us to educate them is they're not healthcare providers in general. They're regular people who need to better understand healthcare so they can adequately represent their constituents on the Hill. So it's important for us to share our message, but it's most important for us to speak for the patients who don't necessarily know that they need to articulate that message.
And that was a big takeaway for me this morning and in the session this morning, is that as physical therapists, how we differ from other organizations is when we go in to advocate, we're not advocating necessarily for our profession, we're advocating for the people that we treat and for our patients. And I think that's a little bit more powerful and can hit more of an emotional nerve within Congress.
Yeah. Actually, to bring the patient's story to the congressional leadership is what really makes a difference. So you can bring all the statistics and numbers you want, but until there's a person attached to those numbers in story is where the meaningful conversations occur. And yeah, one great advocate, Eva Norman. I don't know if you know Eva.
I think everybody knows Eva. Yeah.
What she started doing a couple of years ago was filming her patient on her iPad and then bringing that patient's story directly to her congressperson here, and that was impactful. They remembered the patient.
That's a great tip.
Yeah.
Excellent tip. Now, what were the biggest policy agenda wins for the APTA lately? I mean, I think you could talk about it.
Yeah,
go
we've
ahead.
had one big win lately, but over the last couple of years, there have been 4 big wins that I think I'd like to highlight. One was that in 2016, we were able to get a bill through Congress that provides for locum tenens for physical therapists in private practices. Before that bill was passed, if you had to go on maternity leave or you had a vacation planned, you couldn't bring anybody in part-time to serve the Medicare beneficiaries while you were out. So locum tenens gave us the opportunity for these substitute clinicians to come in and be able to see those Medicare beneficiaries on a temporary basis.
And that's huge because can you imagine, what if, like you said, they go out on maternity leave? What is that patient supposed to do?
Especially in rural America, there is no option.
There's no other options. That's right.
That was the story that rang true, that Sandy Norby was able to get across to Congress that she had to go on maternity leave and nobody was in that rural community to see those patients.
Yeah, and that's a shame.
Another big win was that we were involved in legislation late in 2016 called the 21st Century Cures Act. And this improves coordination of rehabilitation research throughout the National Institutes of Health. So this was a big win where comprehensive rehabilitation research is being funded for an additional 5 years. So we were thrilled to be a part of that coalition of rehab researchers.
That's awesome. Who else was, what other groups were involved there?
APTA, AOTA, ASHA for certain are part of this coalition, but APTA had a large impact through our Foundation for Physical Therapy and the seed money there that's produced successful NIH research.
That's awesome. And as a researcher, that must make you very happy.
Well, you see the impact of research dollars on the academic enterprise, and if you don't have NIH funding, you lose talented researchers to other disciplines. So it was wonderful to see. Yeah. The third is this past December we were able to get language into the annual defense spending bill that added PTAs as authorized providers under TRICARE. This was something that we had worked for years, and if a serviceman or woman who needed PT services, PTAs and OT assistants couldn't provide service for our servicemen and women. So we finally got that passed in December. It's not effective yet. I think it's important to let your listeners know that there's a regulatory process on the back of any law getting changed that provides for the implementation. So stay tuned because it will be effectuated at least in late 2019.
Yeah, we learned that yesterday at the APTA roundtable talk, and I was really surprised at how long something that is signed into law, it has to go through so many committees and public discussions and then back to committees and then finally it can be implemented.
Right.
And I think that's really important, like you said, for the listeners to know that sometimes things take time.
Yeah. And well, we're thrilled about the congressional action and the big victory there, but we also have to advocate on the regulatory side.
Yeah, it's not over yet.
To make sure that implementation does the things that we advocated for it to do. So,
right, absolutely.
Yeah, we're looking at that on the regulatory side, but we're thrilled that we had that win with TRICARE. And then finally, the big one is the permanent fix to the Medicare therapy cap that was enacted in February. This was the result of 20 years of advocacy on the part of our members, our clinicians all over the country, and their patients. Who spoke up. And it was wonderful to see this happen after 17 congressional acts to provide a temporary fix. We finally got the permanent fix, and thrilled with that victory.
And what is the specifics of that permanent fix? What does that mean exactly?
It means that we won't have to go back every December to file for an exceptions process. Okay. It permanently placed an exceptions process essentially on the cap, and you don't have to advocate for that at the end of every year. APTA has identified one, that after you reach a certain milestone, you continue with the KX modifier, but that doesn't mean your patient is going to be cut in their funding at the hard cap. It allows for patients who need continued therapy to continue to get continued therapy.
Huge.
Yeah, huge. Yeah, without the risk of losing that option.
Right. Got it. So those were the big wins. So what are we looking at for the future? What's on the docket? So if there are people out there listening and they maybe want to reach out to their lawmakers, what are some things that they can advocate for?
Well, and that's that huge win allows us to pivot our public policy priorities and our efforts forward. This morning we heard from Ballast Research about APTA's reputation on the Hill.
And it's good.
It is. Quite frankly, I'm thrilled to learn that Hill staffers and Congress people see the value of hearing from physical therapists and physical therapist assistants. But it can always be better. So some of the advice we got as far as advocacy goes is to share with the legislators what you do for your patients and not always go about the money or the payment, but how can physical therapy be a solution to the healthcare crisis in this country? So we've got a lot of ideas, and our Public Policy and Advocacy Committee is already thinking about what our public policy priorities can be now that we have an opportunity to put the CAP conversation behind us. So where do physical therapists fit in population health and wellness is a huge opportunity for us. And so that's one of the things we're going to be taking to the Hill tomorrow, sharing with Congress how physical therapy on the front end of episodes of care or even in a prevention mode can save huge costs to the overall system. Not only save huge costs, but also keep
people
healthy and mobile and safe in their communities.
Right.
So we're going to specifically bring that tomorrow in addressing PT's role in the nation's opioid crisis through our Choose PT campaign. So PT addressing a societal problem such as the opioid crisis is huge, and what we can offer for pain. The role of physical therapy in digital health and technology as telehealth begins to expand, that timed with the opportunity we have with the licensure compact is almost
exciting.
A nice alignment to allow physical therapists to get to people in remote areas who otherwise wouldn't have access. So that's another issue. And then finally, we have some education issues. Loan indebtedness is a problem, and it's one of the things that keeps me up at night because it's really at a crisis level. And so there's a bill currently under consideration called the Prosper Act, and that would negatively impact access to student loans. So we're going to talk tomorrow about the need to include physical therapists in student loan repayment programs.
Absolutely, because then what can happen is perhaps these bright, forward-thinking, wonderful students may not go into physical therapy when they look at how much it may cost and the price of repayment afterwards.
Correct.
And then that trickles down to your constituents and your society and your town and your state.
And your constituents access to a high-quality care provider in their communities.
Absolutely. Yeah, all great issues to bring up for 2018. Now, if you can't get to Washington, D.C., how can you advocate in your own state? What are the best ways for, let's say, people listening to go about doing that?
I think one of the best things I ever did in my home state was to offer a congressperson's staff the ability to come to LSU to see our clinic, our faculty practice, and interact with our students. So, and it doesn't have to be affiliated with the university. Clinic visits are a way for the congressperson and their staff to get to know their constituents in the clinic where they're receiving physical therapy, and they learn so much about our profession by that immersion experience. And the staff person that came with it was Senator Cassidy never forgot me because we hosted that visit, and it was just a natural relationship builder because it gives the congressperson an opportunity to be seen at home in a clinical community, but it also gives you the opportunity to build a relationship. And it has a huge upside and impact on that relationship building. The other thing that is very helpful is getting involved in volunteering in a local campaign. If you don't have financially the resources to give to a campaign, sweat equity is just as appreciated.
Give your time. Sometimes there, even more appreciated.
Yes, putting yard signs out, being at a call center, stuffing envelopes. When they see you as part of their workforce to get elected, they never forget that effort. And that breeds a desire to listen to your issues. So those are two ways to get involved. And then anytime you see your legislator hosting a town hall, show up.
Just go.
And participate, ask questions. And it's good to ask questions about healthcare in general and to show an interest about PT's role in solving some of the issues we face, but also a genuine interest in the public's health.
Absolutely. And I think something that you had said before is you don't just do one thing and then call it a day. Yeah. It sounds to me like it's all about building positive, healthy relationships, whether it be with the congressperson or with their staff, or what we heard this morning was their district manager is a very, very important person to kind of be able to build these relationships with. And Patrick Graham, I spoke to him earlier today, and he said the one thing you want to do when you go to these to your lawmaker is not to go with a list of things you want from them, but rather how can you create a win-win? How can you make their life a little bit easier? What can you do to help them and help their constituents? And that goes a long way.
Yeah, never leave that meeting without offering to be a solution. Is there something I can do for you? Or here's what I see in the district, here's a solution that I think might work. Because, they get offers to help all the time. Please help us do this. Please help us do that. And rarely do they have people show up to be a solution.
Yeah,
and I think PT can. We're problem solvers. It's what we do in our day job.
Yeah, so, absolutely. So make it a win-win kind of of a relationship instead of a just take relationship.
Right.
Makes a lot of sense.
Give at least as much as you ask.
Yes,
if
absolutely.
Not more, and then that builds a great, healthy relationship.
Yes, definitely. And now, as a profession, where do you think we need to move in terms of advocacy for the future? Let's say we look a couple of years down the line.
So one of the things that we need to do in terms of the future is continuing to have a voice and continuing to invite others to come to engage in advocacy efforts. I was thrilled to learn that 77 students are here.
It's amazing.
And these students are here because a chapter or section decided to sponsor their attendance. And once they get the bug, this is the bug that bit me, they're engaged for life into the things that matter to the organization and to our patients. So continuing to invite and bring along our colleagues to the experience is huge. I would also encourage people to donate to the PT PAC. I mentioned a while ago that if you can't afford to donate, then sweat equity is just as good. But if you can't afford even a $20 commitment consistently to the PAC helps the profession support those legislators who are champions for our profession. Keeping in mind that APTA doesn't use membership dues, we can't, legally we're not allowed to do that. So that's the necessity for those PAC donations. So keeping our PAC strong, and it is strong, it's one of the 6 best healthcare provider PACs in the country. And that is why we had such a successful 2 years with those 4 big key successes.
Absolutely.
That and the sweat equity of all of our advocates.
Yes, yes. And now, before we sign off here, what are the key takeaways that you want people to leave from this talk?
Key takeaways: you can advocate from anywhere, from your computer at home to your community to coming to D.C. That's a key takeaway. You don't have to travel to advocate because these legislators want to know what's happening in their community. The other key takeaway is stay engaged and stay in touch with APTA for what our priorities are so that we're all beating the same drum because the message has to be shared over and over and over to get through. So those are the 2 keys.
Perfect. Well, Sharon, thank you so much for taking the time out of Federal Advocacy Forum here in Washington, D.C. I know you're pulled in a million directions, so I appreciate it.
It's great to be here, and thanks for having me, Karen.
Anytime. And everyone, thanks so much for listening. Everything that we spoke about we'll have links to over at the podcast at podcast.healthywealthysmart.com. So you can sign up to donate to the PT PAC. You can find out about some of the issues that the APTA is lobbying at. And there's also an app, the PT
Advocacy app.
Advocacy app, yeah. So that's easy. Just download it onto your phone, and it will give you all of this information as well. So everybody, thanks for listening. Have a great week, and stay healthy, wealthy, and smart.
Thank you for listening, and please subscribe to the podcast at podcast.healthywealthysmart.com. And don't forget to follow us on social media.